You should keep your appointments, but they are going to be in a different form than you might be used to. Most of our patients are having their appointments by telephone, by MyChart, or even now by video visits. So we've been able to shift many of our stable patients to those types of visits, and we can handle many of your concerns and questions, as well as your routine healthy follow-up visits, doing it this way. What you should also know is that if you get sick, we are completely available and we can still see you, and we would work hard to figure out what the best way to do that is. It is safe to come see us in the clinic if you need it, but we'll work with you to figure out how and when that should be done. We have, on the other hand, rescheduled or deferred most of the elective procedures of colonoscopies or other endoscopic procedures. Most of these procedures that we do to look for precancerous changes or for other indications, we feel can be delayed until we're done with the pandemic and we can move forward safely. If you need a procedure because of something that's time sensitive or essential in other ways for your management, we certainly are still offering that and doing it. The best thing to do is to call your doctor or to call your doctor's team so that you know what options are available for you. But don't cancel your appointments and certainly don't stop your medicines. Some of our patients who receive therapies for inflammatory bowel disease are receiving those therapies by intravenous infusions. And that means they go to an infusion center, either at the University of Chicago Medicine or some of the outlying centers that we work with. Those centers are safe. It's important to stay on schedule with your infusions, but we have specifically asked and really required that all the infusion centers have a protocol in place to keep our patients safe and also to keep the nurses who work there safe. The protocol needs to include screening the patient for any known contacts with COVID-19, screening the patient for any symptoms to suggest COVID-19, including fevers or respiratory symptoms, or as I mentioned, digestive symptoms can sometimes be a clue. And the other things that the infusion centers need to do is to space patients apart at least 6 feet, to have a single provider working with the patient, meaning one nurse to patient ratio, so that there are not multiple people exposed to the patient. And the provider should all be wearing masks and gloves and offering those to the patient if they don't already show up with them. The final part of keeping infusion centers safe is to make sure that after a patient has received their infusion, the chair and the surrounding area is appropriately cleansed and cleaned. If you know that your infusion center is doing that, and I can tell you that the University of Chicago Medicine is doing it, and the infusion centers that we work with in the Chicagoland and Northwest Indiana areas are doing it, then you should keep your appointments, make sure you get your treatments, and stay in remission. Delaying the infusible therapies, or for that matter, many of our other treatments, can lead to relapse and loss of response to the drugs. We definitely don't want to deal with that as a consequence of COVID-19. We want to keep you healthy. The medications we use to treat inflammatory bowel disease include a variety of therapies that work by different mechanisms or target different parts of our immune system. We fortunately have many options that we've been using to treat patients with Crohn's disease and ulcerative colitis. Some of them are older, like the medicines that are immune modulator therapies called thiopurines or azathioprinin 6-MP, or another medicine called methotrexate. And more recently, we have a variety of biological therapies which target different components of the immune system. The goal of these therapies is not to suppress the immune system so patients are more susceptible to infections, and that would include this particular coronavirus infection, but rather to control the overactive inflammation of the bowel and let the body heal itself and catch up. We don't always know how to do this perfectly, but we've gotten much better at it. Our biological therapies, for example, aim at specific directed components of the immune system. A whole class of therapies called anti-TNF treatments focus on an inflammatory protein called TNF, or tumor necrosis factor. The TNF protein is elevated whenever somebody has an infection or overactive immune response, and therefore targeting it works quite well for many people with Crohn's and colitis. The treatments that are used in the anti-TNF class include drugs that you may have heard of called Remicade or Humira or Cimzia or Simponi, and these therapies are recommended to be continued at the current time, even with the pandemic occurring. The other therapy we talk about is a drug that targets the white blood cells that might be on their way to your bowel. That therapy is known as Entyvio, and Entyvio works by actually blocking those white blood cells from getting out of the blood vessels into your intestines. So it's a more selective therapy in that it only works on the intestinal immune system. And therefore, it may have a different profile and is something that we think of in a different way when we talk about risks for infections. The risk for infection might be lower than our anti-TNF and other treatments. And lastly, we have a treatment that's known as Stelara, which targets two other inflammatory proteins that go up, and they tend to be proteins that are elevated just where there's inflammation in your body. So it's a bit more selective, but it still works on the entire body. So that therapy we also think of a bit differently. The general message regarding all of these therapies is that if you are in remission and the treatment you're on is working for your Crohn's and your colitis, you should be staying on that therapy, and you should be communicating with your healthcare team about any additional thoughts or changes that might be necessary. For most patients, we are not recommending that they stop treatments, and we are recommending that they adhere to the social distancing and stay at home recommendations, and obviously continue to be very careful about washing their hands and not touching their face. Remember that these treatments are keeping your inflammatory bowel disease under control. If the IBD becomes active, the problem then is that you might need to be on corticosteroids like prednisone, which we worry can actually make things worse for you and definitely have a higher risk of infections. So it's best to stay in remission and to do the best you can to be at home, keep your hands clean, and to follow the other recommendations as they're coming out. Many patients have asked whether they should stockpile their medications or whether there's going to be a national shortage of their therapies. The good news is that the answer to that question is no. We have assurances from the pharmaceutical companies that there's plenty of medicine available and that they can stay on their schedule, refilling them appropriately, and not worry about this. Related to that, I would also advise you not to be taking additional supplements at this time. Some patients have asked whether they should be taking extra vitamins or zinc or other things to prevent a viral infection. There's no data to support that, and we don't want you to start taking new things now that might have a whole other set of side effects or problems that would confuse us during this important time. Part of an international collaboration to develop guidance for inflammatory bowel disease patients who develop COVID-19 is the important distinction between having symptoms from the infection and having an activation of IBD. So if you have a flare of your IBD, remember that this could be part of the COVID-19 presentation. It might also just be that your IBD is flaring. There are many reasons people flare from their inflammatory bowel disease. One of them that patients often tell us is stress, and of course we're all under stress right now. The other would be if you had stopped your medicines, or if your routine in some other way has changed. You might not be exercising like you used to do. Your diet might have changed because you're staying at home or doing other things. And so there are many different reasons to think that you might actually be relapsing. The good news is that we have ways to sort this out that don't require you to necessarily come to the clinic or have any procedures done. And with some simple tests, we can often distinguish between what is a flare of your inflammatory bowel disease and what might be due to an infection, or in some cases, what might be due to stress, but not an activation of your inflammatory bowel disease. Then we do have good treatments available, and many of these treatments are quite safe to start even when we're worried about the pandemic going on. There's guidance that we've now developed and we're publishing that will give people some more information about which treatments to use and when to use them. But the international group of experts said that if a patient has more severe inflammatory bowel disease, even during this pandemic, the usual treatments we use for IBD are safe and appropriate to be used in this setting. So it's important to know that you shouldn't ignore your IBD symptoms or any of your other digestive symptoms. You should be in touch with us so we can work together and get it back under control quickly. The last thing we want is for you to be living with these symptoms and afraid to notify us or afraid to come to the clinic if we need you to, when in fact we could take care of you and get you better. We know that there are a lot of inflammatory bowel disease patients who are working as essential workers right now and can't be working from home despite the recommendations for people to try to do so. It's an important question to know whether these individuals should be taking time off of work or whether they should be doing other things to protect themselves above and beyond the usual recommendations. The way to think about this important question is first to know what the likelihood of exposure and contact with people who have COVID-19 is. For example, those who are working as paramedics or some of the healthcare professionals, doctors, nurses, technicians, respiratory therapists, pharmacists who are interacting with patients are right in front of many people who have COVID-19. They're high risk of exposure. And then there are others who are working but are not necessarily exposed as often. And the second question is the availability of personal protective equipment. If there's a shortage of PPEs such that the person who's going to be exposed to these patients can't protect themselves, it is appropriate for them to ask for a leave or to get support from their doctor's office to do so. It's also important to know that if you have active and appropriate personal protective equipment, you can be working with patients, you can be doing a lot of your job, as long as you're also thoughtful about not touching your face, washing your hands very carefully, and making sure that you're talking to your doctor and your doctor's team to know that you're in remission and that your medications are being managed properly. I know that this is stressful for many people who are in these situations, and it ends up being a case-by-case basis. But for many of them, we reassure them. We, of course, thank them for their vital role in helping us through this difficult time. And then we work with them so they understand how they can modify their risk or protect themselves better. We've learned a bit about the coronavirus and COVID-19 in pregnant women, and it applies to pregnant patients who have IBD as well. What we've learned so far is that when women who are pregnant develop COVID-19, they recover similar to the general population. And although their babies might be born a bit early or a little underweight, for the most part, the babies seem to do well. And in the early experiences that were reported, the babies did not have the coronavirus infection. What we haven't studied enough yet, because of the timing of all this, is what happens if a woman who's pregnant becomes infected with the coronavirus in the first trimester. The data we have from prior coronavirus epidemics and other types of infections suggests it might be okay. But because this is a novel coronavirus, and it's the first time we've seen this, we still need to be extra careful. What we recommend to our patients who have IBD and are pregnant is that first, they make sure they're staying in remission from their IBD. We definitely don't want them to relapse because they stop their IBD therapies, and then they need to be in a healthcare system or hospitalized and increase their risk. We also know that when IBD is in remission, the baby does well and the mother does well. So that's important to keep in mind. But we're also recommending that our IBD patients who are pregnant take extra precautions for what we call strict social isolation. That might mean that in addition to staying home, you're also restricting visitors in specific ways. And even when you need to go out to the grocery store, you wear a mask, you wear gloves, you take extra precautions and wash your hands as we're recommending to everybody. But in this particular case, we'd like you to be extra careful. We don't have data yet to say that there's more to worry about, but we don't want to find out later that we were wrong about this. So I think it's completely reasonable to be on alert and to take those precautions. I don't say this to make people more stressed than they already are. I'm just trying to provide people with knowledge so that they can be empowered to take good care of themselves and to prevent any problems from happening.